Welcome to tonight's presentation on the magic carpet ride. So the magic is clinical epigenetics. The carpet is AMD training. I hope to make this the most transformative webinar you ever studied. Pretty ambitious, but you'll tell me afterwards. All right, here we go. This is Dr. Susan King. Same person, same gene, same set of teeth, and yet the face is vastly different. All right? This is what epigenetics can do, and more. No shots, no pain, no drill, no drugs, no the usual stuff that your patient is afraid to come to see you. So this is new to dentists, just like gravity at one point was new. Newton figured it out in 1665, and eventually it led to space travel. I'm here to tell you that impaired mouth syndrome, once you discover it and learn how to treat it, it would make as big a difference as Newton's atoms, right? So we're empowered to do this by no less than U.S. Surgeon General, who said oral health is more than healthy teeth. It's time to think beyond teeth. So, what's wrong with Dr. Susan when she came? Gorgeous set of teeth, miserable owner, right? The question is, what are these veneers covering up? Right? We just kind of say, oh, okay, you got crowded teeth, you got ugly teeth, you got yellow teeth, you got dead teeth. Why are we obsessed with just pretty teeth and not health, function, and energy and vitality? All right, so Dr. Richard Beisel is one of my mentors. He drilled this into my eyelid. You cannot diagnose what you can't see or don't know. All right, so we figured out how to do this. The detail of this is not important, except that you have to know that this airway and all of her symptoms, which you will see shortly, comes from doing this diagnosis. All right, it's called 3D jaw diagnosis. What I want to focus on right now is, why is this mouth a structurally impaired mouth? Okay, so an impaired mouth is oral structures causing diverse medical, dental, mental, and mood symptoms. Yes, that's what I'm telling you. Malocclusion causes sleep apnea, causes teeth grinding, causes head, neck, shoulder, back pain, and on and on and on and on. All right. So if you have an impaired mouth, you will predictably lead to bruxing and pain and fatigue and hypoxia and degeneration. Okay, so here's Dr. Susan. She said in my class, was secretly hoping that I would notice that she was squirming in her seat and she was miserable. So we gave her this, and 20 minutes later, her pain was gone. We translated that into this appliance a month later, and here's what she has to say.
So I just want to tell you about this appliance, because it's really been something spectacular for me right off the bat. I've always been the type of person that is super active, athletic, been a ballet dancer. But there came a point a couple of years ago where I started to really notice that I had a lot of pain in my left side, my back, that would shoot down my leg. And it started to, a lot of symptoms would come up where I was noticing I couldn't do a lot of the things that I enjoyed doing. I would be walking down the road with my dogs, and I literally had to stop on the side of the street and hit the floor in the middle of a walk. And I would just sit there in pain until it kind of resolved stretched it out, and got back up again. I will tell you that I went to Dr. Liao's seminar because I was hoping that this could be an answer for me. So he delivers my appliance. My symptoms were like seriously diminished. I did not have pain. I could walk all through the square. I really wasn't sure what to make of it. But the next day I knew I was going to fly out of that airport again. And I thought, oh no, I'm going to be going to that airport. I wore the appliance with me through the airport. And when the escalator was too blocked, I felt strong enough to take my luggage and climb the stairs through that airport. And I couldn't believe it when I got to the top of the stairs that I had done what I had did, because I felt like that's how I used to be. That was me. That was how I have always been in my life, that I could climb any stairs I wanted to, dance through an airport. And here I was again. Like, hello, I remember myself again. That's me. And I just felt like I needed to text Dr. Liao to tell him, you gave me back again.
All right, so in the interest of time, we have lots and lots of these cases, so I'm not gonna play the whole video, but you get the idea, right? That this is something pretty transformative, and every one of you have patients like this in your practice. They just don't know that you have this capability yet. Okay, so subjective units of distress, SUD scale, is a validated research tool. It's just the typical 0 to 10 scale, 10 being the highest disturbance, and 0 is, I don't have any problem. So here's Dr. Susan's symptom progress tracker. Okay, she started out with pain left hip, mobility difficulty, acid reflux, mid-sleep wake up, sugar craving, nightmares, pain, tightness, fatigue, flexibility issues. Okay, so she's got 7 on a maximal score of 70. 9 months later, it's down to 11. Okay, so this is subjective, meaning that she rated her own pain. It's not my interpretation. All right, so this is a valid research tool on how much a patient perceives that she has improved. So subtract 11 from 70, you get 59, and divide 59 into 70, you get 84% improvement. Okay, no drugs, no shots, no drill, no pain, just this. Okay, so here she is, not quite 12 months, maybe 10 months later, and she's hiking in Hawaii.
Okay. I'm here hiking the falls at the end of the road to Hana. And we've been hiking now for about 40 minutes or so. And it's pretty rough terrain. And I would say that a year ago, before I started wearing my appliance, I could not do this. I would be afraid to even go 10 minutes into this hike. It's very uneven. There's mud, and I have absolutely no hip pain. And I attribute it all really to.
Well, you know what she's gonna say. You get the idea. Here's the point. In 11 months, she made this much progress in width and this much advancement in her premaxilla. Of course, we just didn't use a appliance, right? We also did bone building diet, right? This is green smoothies, the best from the plant kingdom. This is bone broth, the best from the animal kingdom. Put the two together and you have precursors for making bone, which will fill into the scalp here. And that's where the transformation comes from. We took her from here to here in 10 months. Same set of teeth, completely different face, completely different medical destiny, completely different outlook. And we hope later on she will drop in and tell you her personal experience live, if her schedule allows. So this clinical epigenetics, I coined this term in 2023, is a new solution for a lot of persistent problems, right? So we'll get into what those problems can be later on, but right now I want to just introduce to you what clinical epigenetics is. According to CDC, epigenetics is the study of how behavior and environment affect how genes work. Okay, so it means that if we want to turn on the epigenetic, we just need to focus on two things. What are they? Behavior and environment. Oral behavior and oral environment in our case, okay? So, in order to understand this, we need to understand what a normal physiological mouth is. So to my patients, they know me as a holistic dentist, so we call it a holistic mouth, okay? And so the mouth is where every one of us grew from as newborns, okay? If we want wellness, the mouth is the root of our wellness. And why is that? Because the holistic mouth is defined as one that is structurally fit and sensibly used to support whole body health through these physiological functions: alignment, breathing, circulation, digestion, and energy and sleep. Okay, so that's A, B, C, D, E, S. When these functions work, because the mouth is structurally fit and sensibly used, the body will thrive. Take it from me, I've done this for almost 15 years now. It works every time. So when you don't have a structurally fit mouth, you're going to have what I call impaired mouth syndrome, which consists of many medical, dental, mood symptoms from jaw failure to thrive. Now I want you to pause for a moment and think about how many of these teeth do you see every week? And how many of them you have in your mouth? Crowded lower front teeth, bruxing, fractions, TMJ, chronic aches, pains, head, neck, shoulder, back. How many of your patients, oh, I need a neck roll before I get into a chair. I need a pillow for my lower back. Oh, let me put chapsticks on. These are all missed opportunities to diagnose impaired mouth syndrome. Never mind bicuspid extraction. Never mind CPAP. Never mind children who come in with sniffles and super crowded teeth, needing to go see the orthodontics. Never mind adults who's got fatigue, depression, anxiety, and irritability. You got patients who are rude to your front desk? Yeah, they need help, right? Okay, so how many of your patients have these symptoms? These are just bruxers, okay? Symptoms that commonly go with bruxing. Wake up tired. You know, you can read these. There are 8 of them here. Just finger count yourself. How many of these you suffer? Okay, so we will help you treat yourself successfully. Okay, persistent pain. Let's just take that. And TMJ dysfunction. Okay, this is one of my patients. I had her husband holding my iPhone while I grabbed her medial malleoli, the ball of her ankle inside. They hear my thumbs, and her leg lengths were different because the dental midlines are not on. When I put the appliance in, she knew exactly how to close. Guess what happened to her leg length? An instant shift. Why? Because the mouth is connected to the pelvis through the spine, and through the pelvis, the legs are connected to the mouth, right? So, the husband said, you know, if I wasn't looking through the lens with my own eyes, I would never believe these pictures. But it is true. Here's the next case. Here's a study from Kyoto University Medical School. They took 3 beagle dogs, put them under general anesthesia, took a high-speed handpiece, mowed down the lower right posterior. When the dogs woke up, they become lame on the contralateral leg. So they concluded that there's a systemic effect to the trigeminal nerve. It is not just what we thought, what we learned in dental school. The dermatome ends in the mandibular area, okay? So how many of these patients do we have in our practice? Well, I would tell you that you have about 80% of your patients at these problems. All right, so we live in a field of gravity, which never stop putting us toward the grave. In order to resist gravity, because we are upright animals on two legs, we need to have a level and square structure. That level and squareness run through the entire postural plane. That includes our occlusal plane, okay? So this is what a physiology should be like. And this is what patients brings in. It's our job to recognize the normal from the pathological. So this midline was off. By the time I got the appliance in, her midline was on. Okay. So this patient came in just before a pandemic lockdown and said they canceled my hip replacement surgery. It's killing me. I can only sleep in 2-hour chunks. Can you help me like you did with my friend with her low back pain? I said, well, let's give it a try. And I took one look and this is her midline. And sure enough, that's why she had the pain. How do I know? Because some brilliant dentist from the Pierre Fouchard Academy, an excellent operative dentist, made some wonderful crowns that locked in this crossbite and perpetuated the midline discrepancy with this perfect tusk to fossa relationship. This patient had no chance to escape this hip pain. It only took years to show up. So I could not even line up her midline with my appliance, but it didn't matter, right? So 3 months later, she sent me this emoji. It says, hip hip hooray, zero aching last night. I was so grateful that I could sleep through the night. Okay. So you can do amazing things. You can change people's lives. You can change your practice even if you start doing this. Here's a bicuspid extraction case. I'll have more to say about that later. Take it from him that he said, this is a video which I won't play, but I'll play the next one. He called this my healthcare home run. Okay, this guy already eats healthy. He already exercises. He's an engineer. He takes really good care of himself. Okay. So I'm going to just play him this part here.
And one more thing to add, I feel like with the first week with the appliance, my musculoskeletal system, my bones are slowly just moving to where they want to be, which feels great. And then I'm feeling improvement in my left knee has had a little issue and my left hip. So I've been struggling.
Left knee and left hip is
Left
getting
knee
better
and left hip are getting better
from a mouthpiece?
from a mouthpiece.
Would you have expected that?
No, not at all.
No. And it is patients like Brian whose experience is informing doctors about what's possible.
Mhm.
When you straighten the mouth, the rest of the body would have a chance to straighten up.
Yeah.
Is that true?
I feel it, yeah.
Thank you.
They feel it, indeed. Okay. So what I can tell you is this: the takeaway is that impaired mouth disrupts whole body health more than polio. All right. So polio, you get sympathy because people see that you're not able to function normal. If you have an impaired mouth, nobody understands you. You suffer. How many of you suffer from neck, shoulder, back pain? Yeah, our profession doesn't help. But you know what? 80% of your patients have this issue. If you ever say to them, hey, let's see if there's an oral contribution to your neck pain, You'll be surprised how many people would jump at this. I'll show you the patient response a little bit later. But think about chronic pain and fatigue. Absolutely, the mouth has a huge contribution. Bruxing, what is bruxing? This is how I got started down this path, right? Crowded lower anterior teeth. Well, why is crowding so crowded, right? And what are we doing about it besides braces and clear trays? I'm telling you that you can fix a lot of things this way. This is the way I practice now. 2 days a week, 10 a.m. to 3 p.m. No shots, no drills, no drugs, no surgery. And my patients love it. You can see her smiling here. There's no pain because I'm working outside her mouth. And through that, and through these principles, okay, so I coined a new term called MASA access. You heard of NASA, right? So this is MASA, mouth, airway, sleep, alignment. You fix this and the whole body gets better. And clinical epigenetics allows you to use this and nutrition and nasal breathing and myofunctional therapy, and you can change people. So let's understand what a holistic or physiological mouth should look like, okay? Broad cheekbones. I tell my patients, in corner of the eyes, the corner of the mouth, ear to ear, it's the maxilla. When maxilla reaches full gene expression, you have broad face, balanced head, aligned jaws, radiant natural health, and spontaneous joy. This is Dr. Weston A. Price's work. Instead, this is what we're getting, right? They got crowded teeth. Kids are grumpy. Mommy's stressed out. What are doctors doing? Our job is supposed to help them find answers. So the jury is in from no less than Stanford Sleep Center. Pediatric obstructive sleep apnea is a disorder of oral facial growth. Your jaws don't grow, your face don't grow, your airway don't grow, and you have sleep apnea. Plain and simple. All right. So like my mentor says, you can diagnose what you don't know. Now we know. Oral facial growth stops sleep apnea. Who's trained to do this? I submit to you, it should be us dentists. Right. So you can choose to be a cosmetic dentist and do veneers on miserable patients, or you can treat the root cause here. The mouth, when it's structurally impaired, is the root cause of sleep apnea. And this is Dr. Dave Singh's, another guru in dental sleep medicine. This is his research done at University of Malaysia. It only takes 7 to 10% narrowness for you to end up with OSA. All right, this completely backs up this. All right, so I've since gone to develop my own appliance. And my appliance is an orthopedic device for redeveloping and realigning the jaws to reduce pain, teeth grinding, TMJ dysfunction, snoring, upper airway resistance syndrome. Notice I did not say what? Sleep apnea. I strongly feel that sleep apnea is a medical condition that should be left for medical doctors. What we do treat is oral contribution to anything and everything. You are licensed to do that. U.S. Surgeon General says we should do that. And I'm here to show you what else to do to amplify your impact on your patient's whole body health. So this is what start driving appliance looks like. The distinguishing feature is that one, there's a parking spot for the lower incisors to fit into. In the process, we open the vertical and lengthen the AP, and that more than makes up for the room that the acrylic takes up. All right. If that's not true, then I wouldn't have the successes that I have had. But we don't just stop there, right? So it's the oral environment using this, and then the oral behavior using a bone building diet. It will support maxilla and facial growth. It was treat snoring and mouth breathing. It would raise beautiful children. It would basically have your patient come in with facial radiance, that glow in their face, that shine, that lovely smile that is bone deep, not just veneer surface. Okay. All right. So here is an example. Okay. Look at this. This is a jaw structure where, so this is called Schwartz model analysis. The maxilla is -5, premolar, first premolar, okay? And on the lower is -4. Guess which one is smaller? It's 5, okay? And the molars, -2, which is smaller than -1 on the lower. That means this maxilla is too small, okay? And that is the consequence of this, or the root cause of it. This is the consequence, right? Start asking your patient, you got head, neck, shoulder, back pain? Well, start looking to see if they have impaired mouth syndrome. And this is one way we determine impaired mouth syndrome. When the maxilla is too small for the mandible. Because we say the maxilla should be like a shoe. Here's the upper jaw. Here's the mandible. Okay. The mandible needs to fit into a maxilla. Which one needs to be bigger? Well, start doing our homework and start making the diagnosis, connect the dots. Okay. Here's a set of mouth. Gorgeous, well-maintained perio, clean teeth. Why is the patient miserable with pain? Jaw pops after she started doing clear aligners. Okay. She always wanted straight teeth and she had crooked teeth. Why? Because the jaw failed to thrive. Right? Now we know. Okay. So dental school didn't teach us that. No problem. You now have a way. Jaw clenching since forever. Why? Because she's got a airway that's not sufficient for her to stay sound asleep. So she's got to take that sleepiness for 20 years. Okay. This is her neck. And that's where she points to having her pain. Well, I'm telling you right now that every neck pain has got an oral contribution by about 80%. When we got done, I want to show you, this is pre-treatment on the CT. This is post-treatment. Without an oral contribution or oral treatment to the oral contribution, the neck would not straighten. Okay. So how many of you suffer this yourself? We got this result because we did our homework on fixing the mouth based on the findings. The jaw's too narrow, maxilla worse than the mandible. And this is called cephalometric tracing. We will teach you how to do that if you decide to take up A&D training. And I'm gonna encourage you that the more you learn this thing, the more powerful a diagnostician and the more powerful your treatment outcomes. Okay, so based on these findings, we gave her this appliance, and I want you to pay attention. And we get a lot of pushback that says, oh, that can't be possible on someone who is no longer a teenager. You're going to take off this appliance at the end of the orthopedic treatment. You're going to tell me, are they buccally flared? This is not the only case. All right, here's the airway comparison, pre-treatment. My CT died between her pre-treatment and her post-treatment. So that's why this one you had to read the numbers. 112. Minimal cross-section. Let's call it 113 here. Okay. Post-treatment, 162. Okay, 43% gain. Airway volume, 7.5. Airway volume, 12.3. So we have a cephalometric comparison. This will mean more to you after you take the training. But let's take a look at her. At the end of phase 1, orthopedic treatment, now she wants to get her lifelong crooked teeth treated. And so here we are, straightening her. And I want you to look at her subjective units of distress progress. Okay. Everything improved. Pain in the shoulders and the rib dropped from 10 to 1. Daytime sleepiness 10 to 1. Jaw clenching went to 0. Jaw popping went to 0. Crooked teeth. This is before we started the phase 2 work. So it's still there. When you add up all the scores, she went from 50 to 5. She improved 45 to 5, 45 into 50, you have a 90% improvement. Again, all of this, no drugs, no shots, no drill, nothing. You tell me which area of medicine can deliver all this across all the symptoms. For those of you who find this hard to believe, well, I published this in the Journal of American Orthodontic Society. Okay, the voice of all the general and pediatric orthodontic practitioners. So we have to have a male. It works not only on females, it works on guys too. So here's a total male case, okay? He's got witness apnea by his wife. This is pre-treatment, okay? Now you can see that his arch didn't look that bad, but he had fatigue. He's so tired, periodic limb movement, anxiety, neck shoulder pain. My back is a mess in her own words. He wakes up refreshed 0 days a week. This is a really useful question to ask your patient. How many days a week do you wake up feeling refreshed? You'd be shocked. It's a great conversation starter for engaging patients. So again, here's pre-treatment on the left. On the right, at the end of phase 1, orthopedic appliance treatment using this and this, right? This is his wife's report.
Hi, I'm Shannon Martin.
Yes.
I am the wife of one of Dr. Liao's patients.
Okay,
And over the last 9 months, or is it a year, he's been using Dr. Liao's process and program to straighten his teeth out and help him have better breathing and a healthier life. So what I've noticed is that he is sleeping better. He's not waking up in the middle of the night as often.
really, okay.
He's not having, he used to flail a little in his sleep, which he's not doing and waking me up, of course, which I
Okay, okay, so you can tell that firsthand, right?
Yes, he's also had a better memory, which is really important because, you know, we run our own company and that is very noticeable to me.
Fabulous, yeah.
Otherwise, I mean, he's got a lot, he's not waking up and like coughing himself awake, like he's not choking. I mean, he's not snoring as much either, which is nice too.
Wonderful. Well, thank you for sharing your experience with us.
Yeah, thank you.
Thank you.
Bye.
So this is a joyous practice. We don't get complaints. We don't get, oh, I'm still sensitive after all this time. Now I want to invite you to look at his posterior teeth at the end of phase 1. Is there any posterior buccal tipping? I would say no. We disagree on which type of clear tray to use, so he went his own way, but I want to show you the comparison at the end of the phase 1 appliance treatment, how far he progressed. His maxilla went from -6 to +2 in the premolar area, -1 to +5 in the molar area. This is a gain of +8 and +6 from pre-treatment to the end of phase 1 treatment. How do you grow the maxilla this much without tipping the posterior teeth? Well, I submit to you, this is not orthodontic mechanics. This is clinical epigenetics. We combine a lot of things together, which you'll learn in A&D training. So here's a comparison. Pre-treatment, the airway volume went from 21 to 33.8 cc, okay? So here 33.8 post-treatment, and here is 21, right there. Okay. So the minimal cross-sectional area went from 279 to 85. We have a 61% gain in this airway volume, which is the reason why his wife explained in this video, and this is his own subjective units of distress. He improved 90% on all these symptoms. Apnea witnessed by his wife, that by itself, according to American Academy of Sleep Medicine, is sufficient to make the diagnosis of OSA. Teeth grind, crowded teeth, so tired, anxiety, pain, wake up refreshed 0 days a week, okay? He went from 60 to 6. Subjective, meaning that he rated his own progress. I didn't impose my judgment, okay? So there's no operator bias here. We got a 90% gain. Every one of you have patients like this who are waiting to be rescued. But it's gonna take a different kind of doctor, okay? A dentist, we're training dental school to fix tooth problems, perio problems, root canal problems, braces for crowded teeth, sure. This is traditional dental problems. Well, now we have a new frontier, okay? So this is airway, mouth arteries, we fix what? MASA, mouth, airway, sleep, alignment, axis. And this is what we address. Now, you need patients and hygienists and general dentists to do the foundational work. We need sound teeth in order for AMD to do this. But how many of you have just patients who just keep coming back for checkup and cleaning and there's nothing else doing? Well, you now can start these conversations. Okay, so AMD, airway mouth doctors, the new breed of airway dentists. We're trained in the diagnosis of impaired mouth syndrome. We're trained in how to deliver clinical epigenetics so that the maxilla reaches full gene expression, room for all the teeth to line up straight naturally, so that there's lip seal through bone building diet, facilitate bone breathing, nasal breathing, and absence of tongue tie and normal swallow, okay? And we can actually make best face. You'll see that shortly. And AMD is all of this. An upper airway diagnostician, impaired mouth expert, craniofacial architect. We're cross-training in integrative health. We are unrivaled in wellness in the community. So this is what a fully developed maxilla is. This is the basis of best face and top hat. For that, you need nasal breathing. There's a famous experiment done in Sweden by Expo Pablo. Okay. He used silicone plugs, plug the baby rhesus monkeys nostrils. Guess how they grew? I mean, doesn't that glazed eye look just like a lot of your pediatric patients? It's because nasal obstruction runs rampant in modern America today. Okay, so here's the frontal view of a CT scan. Here's the cranium, orbit, sinus, nasal tunnel, floor of the nose, roof of the mouth. Here's the maxilla in the sagittal and coronal view. Okay, so look at this nasal passage. Black is air, gray is tissue. Where is air gonna go through here? There's lots of other diagnostic cues that you can pick up when you do the treatment. Well, part of the reason is that, the fast and inconvenience food runs amok in our society, and mothers are busy, sure, and so there's this drive-through solution, right? Well, look at what the ranking is. Everyone else gets an F except for these few. There's only 2 that gets an A. This is antibiotics and beef sourcing, okay? So when you eat standard American diet, you're gonna get all of this nasal obstruction and sinusitis, and you're gonna get this complaint about snoring. And well, I have news for you, by the time a man gets referred for sleep test, 2/3 of them already have erectile dysfunction. Not this patient. He is a physical therapist who worked with me. And when he first got started, his midlines are off, and we're done. 5 years later, it took a long time because he was in crossbite here. Okay, so you can say this out loud since everybody's muted. Repeat after me. I have everybody do this in my class in A&D training. Crossbite in adults is a bitch. You heard it. You can say it to the patient. Make sure they understand, okay, that the onus is on them to overcome this. Well, this guy's a super compliant patient. We got his crossbite done, and look at his posterior teeth. You tell me whether it is buccal ticking. So in order to take him from here to here, we grew his maxilla again, -2 to +6, +1 to +8. Okay. Now look at the lower. 5 years later, is the maxilla big enough for the mandible? Yes. I want you to see how his deviated septum straightened without surgery. Without me tracing the septal deviation, you can see it with your own eyes. And you can see it with your own eyes right there. So now people ask me, well, how come I get this? Or how come my patient gets this? Through some other program I learned. Well, here's a reason, okay? This is mechanics. This is not epigenetics, okay? When patients comes in with tipping, they are relying on just the appliance to what? Crank. Is there a bone building diet to support the cranking? No. How many hours patient wearing the appliance? You can't wear this like a night guard. This is a growth appliance. You wear it 12 hours on, 12 hours off, your net gain is 0. So you need to wear this thing 14 to 16 hours a day if you're going to get anywhere. You got to do the bone building diet. You got to make sure you can breathe through your nose. This poor patient had Roto-Rooter job for his nasal passage, poor thing. And guess what? They grew back because the diet did not change. Oral behavior and oral environment. That's the essence of clinical epigenetics. This is our job. We need to replace our mental software from dental school. We need to start looking into impaired mouth. We need to offer clinical epigenetics. Let the genes express. Take the foot off the garden hose. Let the best face shows up. Like this. This patient wanted to kill herself in the height of pandemic. She reached out to me from Australia. Look at this gorgeous set of teeth. Her family said, what are you complaining about? Well, 2.5 years later, she looked like this. Look at her posterior teeth. Do you see any buccal tipping? So here I want to tell you about AI, artificially imposed orthodontics. If you have had orthodontics or if you do orthodontics yourself, you know that every patient is fitted with this arch form. Well, what makes you think that this is suitable for everybody? This is one arch form imposed artificially by all the dentists who do orthodontics. Where does gene expression come in here? It didn't. That's why it relapses. Okay, this is gene expression. This is a better version of the same face with the same set of teeth showing up. Her airway went from 13.8 cc's and a minimal cross-section of 111 to 237. Okay, we more than double her airway volume and her minimal cross-section. This is the power of epigenetics. You're going to transform lives. She, of course, no longer is killing herself, right? So you get incredible career fulfillment from a painless patient-doctor relationship. I don't know about you, but this turns me on and it makes me want to go to work every day. And I don't come home tired, rubbing my neck, rubbing my back. Your child's best face, we don't have time for that. If you're interested, reach out and we can put on a separate seminar. But this is my granddaughter. You think we're going to put an appliance on her? No. This is what gene expression means. Okay. She is developing not according to AI, artificial imposed whatever. We are growing her according to genes. But she looks, no appliance is necessary. But there is a whole bunch of things you have to know about clinical epigenetics. Now I'm going to bring this to a close now. You've been patiently sitting through this. So there's a paper called Totem Pole Hierarchy of Survival Reflexes. Now, where somebody looked at what it is that we need in order to survive. First thing is breathing, second one is eating. Guess who's on top of the totem pole to take care of that? It's us. Those of us who choose to go from tooth doctor to Airway. So here's a gorgeous set of teeth. But the patient has all of these problems. Pain, bruxing, chronic skin issue, candida infection in the groin, acid erosion, abfraction, recession. I have no doubt that he also has fungal toes, and he's got crowded lower anteriors, and he had braces in his teens, and he's miserable, right? Well, in the past, I used to say, hey, those problems, go see some other doctor. Well, now I've changed my attitude. You're my patient, your problem is my problem. Let me help you see if there's an oral contribution to this. And sure enough, his maxilla is too small for his mandible. Look at the molar area. His lower molar is 5 millimeters in the plus and 0. Which one is bigger? The mandibles. Maxilla -2, 0. Which one is smaller? So that's why he has all these problems. Okay, so you will learn how to do all of this diagnosis, and then you know how to target these deficiency with a solution that will solve this 6-foot tiger, 3-foot cage issue. So let me just tell you that when you restore mouth, airway, sleep alignment access, you will restore whole body health. Now, we're not just fixing teeth anymore, okay? We're restoring whole body physiology. One of my dentists, newly trained AMDs, went back, and guess what? In 1 week, she came up with that many cases. Patients are dying to buy this kind of solution. Here's Dr. Maria Dwyer, North Dakota, Bismarck, hardly a population center. She started 51 cases in 2 months. See thanks. Difficulty sleeping is a risk factor for depression and anxiety. Mental health is getting the attention that it deserves. The natural way to fix any kind of mental health is sleep. Insomnia leads to 20x for anxiety, 10x for depression. It's one of the dentists, one of us. So I'm sure some of you in here suffer from this. TMJ, pain, poor sleep, and more. Look at her face in 12 months. He said, I am living impaired mouth syndrome right now. Severe chronic TMJ, fatigue, teeth grinding, and restricted airway. We gave her this appliance, gave her the bone broth, and the green smoothies. Here's what she said. Jaw pain went from 8 to 2. My sleep quality went from 8 to 1. My right hip pain clicking went from 6 to 0. Right hip clicking, ladies and gentlemen. Headaches, 6 to 1. Back pain, 4 to 1. Brain fog, 5 to 2. Poor digestion, 4 to 1. Everything added together is an 81% hit. This is how big an impaired mouth is. Can conventional medicine and can drill and field dentistry deliver all of this to the tune of 81% in 10 weeks, okay? This doesn't take forever. Symptoms get better very early. I can tell you that 80% of all the symptoms that your patient brings to you and to their medical doctors have an oral contribution. They're in this no man's land where the doctors don't know and the dentists don't know. So this is a great opportunity for you to expand your practice. I can tell you that from my patients' experience, they tell me that once their impaired mouth is treated, once I make this diagnosis, it's just a treatment plan, all of these get better. Through their case experience, not through my own claim. Okay? So now you are empowered to restore whole body health by month, simply by recognizing this problem and delivering a painless solution. So I invite you to AMD treatment. Pause. This is going to change everything like this. So we have a huge discount for those of you who took the time to come and attend this webinar. Make sure you reach out to Denise at holisticmouthsolutions.com. Just take a screenshot of this, okay? Denise at holisticmouthsolutions.com. Again, I'll give you an 800 number if that's too much. You can do this yourself. Okay, so from here to here, it's 2.5 years, and she delivered a baby in between. This is what her mouth looks like. We always overextend and let it settle back into mouth directed occlusion. That's when they do not relapse. She too, in 2.5 years, deliver a baby. You're not supposed to look better, but they all did. Okay, this is what she looks like. Even though she looks awful, her midlines are on. She's got buccal overjet, and her posterior teeth are not tipped. And look at how much better her face looks. So she's sleeping better, and she's no longer. So only you can rescue your patient who are turning blue inside, suffering from impaired mouth syndrome. So here's the 800 number I promised you. And you can claim your discount simply by reaching out to Denise. If you have any questions, feel free to reach out to me here. And with that, I'm going to open up for Q&A. You can unmute yourself if you feel like speaking up. And if not, we're going to pause the recording here.